The roads have been swept and the fires extinguished in some of South Africa's largest cities. But the damage caused by days of violence cannot be set aside. The unrest erupted in a fragile land, battered by wave upon wave of coronavirus. And the trouble will make the current surge of infection significantly worse.
Many of the individuals involved in looting simply don't care. They don't care about the rules, and they certainly don't care about wearing masks or social distancing. And so we are likely to see some super spreading events, especially when they got into, several of the big shops in large numbers without masks. That's going to create, super spreading events.
That's the last thing South Africa's beleaguered health system needs. Infection levels in Johannesburg exploded after the Delta variant took root, and the region's hospitals have been overwhelmed. Lacking insufficient beds, patients are often held in casualty departments for days. This video provided by a member of the public. Leading experts are scathing.
In a province such as Gauteng, where 25% of the population live, our hospitals are completely overwhelmed. But at the same time, we've got beds that are literally vacant in the hospitals. And we can't actually use those beds because some government official forgot that you actually need to have healthcare workers available to actually staff those beds.
As the country's hospitals struggle, community groups have stepped in, running ad hoc clinics and ambulances that do emergency house calls.
Since the third wave has hit in, we've been working 7 days a week with hardly any rest.
The paramedics donned their suits and were led to the bedroom of an 84-year-old called Mohammed Davids.
Uncle? Don't worry about anything. Everything's gonna be okay, all right?
He contracted COVID a few days earlier and was finding it difficult to breathe. And his daughter said he wouldn't eat or drink.
We see he's severely dehydrated.
I can see.
He's severely dehydrated.
You're sort of doing the work of the doctors and nurses in hospital.
Yes. But I have to. It's my dad.
How do you think he's doing?
Guys, you see, we also need to
I'm not used to seeing him like this. So I lost my mother 2.5 months ago.
Okay. Soraya told us her father passed away a few days later. One of more than 200,000 South Africans who've lost their lives to the virus. Across the road, the Kasims were watching and worrying from the garden fence.
We dare not go out. We're too scared to go out.
The couple are eligible for a jab, although South Africa's vaccine rollout has been slow and inefficient. Nevertheless, they've made their minds up.
We have to go.
Have to go. Why have you not had them yet? Are you a bit worried about vaccines?
Yes, too minded a bit, but
what
we've decided now.
You've decided now?
Yes, we must go.
Less than 3% of the population have had a vaccine, and the unrest has damaged the rollout at a crucial time. In Durban, supplies were disrupted, while nearly 50,000 vaccines were destroyed in the looting.
We would have, in this period, have vaccinated close to 500,000 extra people at high risk, in the elderly group. So I think all round, we are sitting in a situation where we have been set back quite significantly.
The government must rebuild the rollout and prepare for the surge in a country that has been pushed to the limit by the pandemic. And the discontent expressed here should serve as a warning to us all. John Sparks, Sky News in Johannesburg.